Hi everyone! Welcome to the Civil War Monitors Behind the Lines. I'm your host, Katie Brackett-Fialka, and today I'm talking with Diane Sommerville, who is Associate Professor and Vice Chair and Director of the Department of History at Binghamton University. She has published a number of articles and book chapters in publications such as Civil War History, and most recently wrote a piece for PBS on their show Mercy Street. She's currently working on a book entitled Aberration of Mind, Suicide and Suffering in the Civil War Era South, which is what she's here to talk to us about today. Welcome, Dr. Sommerville.
Thank you, Katie. I'm very glad to be here.
So, why did soldiers commit suicide during the Civil War? I know there's probably lots of reasons, but did you find any trends?
Well, the thing about why people committed suicide in the 19th century is a little difficult to definitively determine, right? Because for the vast majority of these men and women, they did not leave notes. So we are reliant upon what the newspapers tell us or what those witnesses surrounding them told us. So I always like to start with that caveat because there's really no way to know for sure. So much of what I do is I simply try to look at a lot of the cases and then build a case for the similarities, the context, so that I try to get a sense of patterns. And one of the most interesting patterns that I noticed was that there were a fair number of Confederate soldiers who committed suicide before they even got to the battlefront. To me, that didn't mesh with my understanding of what war trauma was about. War trauma is about being in battle and being scared and seeing horrific things and then becoming traumatized. And that's not what was happening. Instead, a lot of these young soldiers were, in fact, encamped, and they committed suicide before they had even broke camp. And so, because there were a number of these cases, I look back and I begin to see that there was and I just interject here that I've had to go to look at other wars and the experiences of other soldiers and veterans to sort of help me build my understanding. And so I learned from other wars that there is something called, anticipatory fear reaction, which is that these soldiers were anticipating going off to war. Many of them, as you would well imagine, get a lot of physiological symptoms like accelerated heart and nervous disorders. But the most extreme cases of these actually became so anxious about going off to war that they actually killed themselves. And what I argue, and again, this isn't anything that any one of them wrote in a letter, I argue that this was a very gendered reaction. Southern white men were steeped in a culture of honor and of certain notions about masculinity. And they were quite nervous that if they went to battle, they might become frightened and embarrass themselves. And of course, in their minds, quite possibly, they would be burdened with this reputation of having been a coward for the rest of their lives. And so rather than take that risk, they kill themselves. Another component, which is very gendered, is this notion of mastery and control, which of course is another corollary of 19th century masculinity in the South. And killing oneself, especially in the ways in which some of them killed themselves, which was brutally by slashing their throat, emphasized the element of control over a situation that wasn't very controlled. And so that's sort of what I see as the war-related factors and cultural factors that weighed in when these men committed suicide.
Okay, so how would you compare or contrast that with suicides on the home front among civilians?
Okay, good question. I do have 2 chapters in my forthcoming book about the home front, both during the war and after the war. And suffering is a really big part of my story. And so through the Civil War, through Reconstruction, whether it's soldiers or civilians, whether it's African Americans, there is this common notion of suffering,
Mm-hmm.
and women too are suffering on the home front. And one of the ways that I approach my study is to emphasize the fact that many of these women were living in the war zone. And so what drives a lot of them to become mentally ill, or in extreme cases to kill themselves or to contemplate killing themselves, would be sort of what would be considered typical. Typical is not the right word, but not war-related
Okay.
issues like postpartum depression, right? But the problem was that as these women are left alone, the normal social net that is there in a community to help them is also depleted and compromised and taxed. So these women who are having their babies and those who have in the past had postpartum complications, the war zone context makes their suffering exacerbated, right? So as a result, they are left without their husbands, oftentimes their older brothers or younger brothers that might step in and provide assistance. They might feel that they're ill-equipped to step in on the farm and replace their husbands. They have a lot of feelings of inadequacy. There's a lot of dread. They don't know what they're going to do, how they're going to feed their children. They hear rumors that armies are coming their way. Should I relocate? Should I stay? So all of these psychological stressors are brought to bear on the household. Now, those are very different stressors than the soldiers experience, but nonetheless, the reactions oftentimes are severe anxiety, severe depression, and then, of course, suicidal thoughts, with some of them actually proceeding into suicidal attempts.
Wow. Okay, so why do you think it's really important for us to understand these instances and stories about suicide, both on the battlefront and the home front?
Well, I think that if I would have tried to tell this story 10 or 20 years ago, a story that emphasizes that white Southerners suffered, it might have had certain political ramifications. Why are you talking about the suffering of whites? They started the war. What about the suffering of slaves? And I really just want to understand what the home front was like, what it was like for these soldiers and how they experienced the war, and not necessarily I certainly don't want to say that we need to feel sorry for them. I just want to understand it, because I think moving into the Reconstruction period, I'm beginning to sort of put together a picture where Southerners are brought together in this experience of suffering, right? So we've studied post-war South through the lens of race and class, but one of the things I think that makes Southerners, white Southerners especially, feel connected to others is that they've jointly shared all of this suffering. Mm-hmm. And so, yes, of course, there's the race. Yes, of course, there's class, but there's also this experience that pulls them together. And what I'm trying to do as I finalize my manuscript is kind of figure out where this all fits in terms of identity for the post-war period.
Very, very interesting. So if listeners are interested in learning a little bit more about your work, where could you send them?
Well, there's a Civil War history article that's accessible on the soldiers
Mm-hmm.
during the war. I most recently, along with my graduate students, wrote pieces for the local affiliate here in Binghamton of the PBS network, which is WSKG. So if you go to the WSKG website, you can see a short, popular interpretation of suicide in the Civil War based on the series Mercy Street. So you can see that, and hopefully by summertime I'll have my manuscript sent off to the publisher. So hopefully next year anybody who wants to learn more about this can order my book.
Great. Good luck finishing, and thank you so much for talking with us today.
Thank you for having me, Katie.